Mark, thanks for joining us today on our In the Trenches video series here, where we interview top advisors that are doing something just a little bit different to kind of just showcase what's working today in the industry. I would love to hear about your practice, how you got started, and what your take on it is that's led you to the success you're seeing today.
Well, thank you so much, Brad. It's a pleasure to be here. I started in the business of financial planning, life insurance, long-term care. So I have the background. I was actually president of my local financial planning association chapter, but I also worked as an elder advocate. And so the transition I've had from insurance, financial planning, elder advocacy has put me in the market of Medicare. What I have seen is that Medicare is such an important topic for so many people. People really value the insights on someone who really understands the details of Medicare. It's a topic that, quite honestly, financial planners, CPAs, estate attorneys realize that it is of great importance to their clients. On the other hand, they don't really have the knowledge or the expertise or really the go-to resource. I have seen that people really appreciate the fact that there are experts out there, and it's not necessarily the insurance company who is focused very much on their product all the time. It has been an incredible success. And I can only say that people who have added Medicare to their book of business have seen a nice annuity. People who have added Medicare resources to their mix with a professional who can support them has been able to give value add to their clients.
And that's amazing. And you use a variety of white glove services to build your book. But I think one of the interesting things that you do, and correct me if I'm wrong, but you partner with other advisors to be that expert. And how does a relationship like that work when you're working with another advisor or planner to really kind of support the value add to their client base?
So I work with hundreds of advisors. I've done lunch and learns all across this country. I also have spoken at different chapter meetings at some of their continuing eds. So a financial planner will either do a soft handoff and a referral. Some will be on a Zoom call together, or some I will actually meet them in their office, and we will talk about the strategy around Medicare, the strategy around health care planning, Medicare planning, and what the impact is financially for them going forward. So there are different ways, and I'm flexible in terms of how to work with different allied professionals, but I truly value the work that they do. I believe this adds to their holistic work with their clients, and they're grateful that they have a resource.
And how, just a couple more questions here, how does one go about becoming a Medicare expert, as you so efficiently have? I mean, you're kind of that go-to guy, right? Well, how do you get to that level? Should an advisor, should a planner look at learning that themselves? Is it easier to, work with someone like yourself? Or how does that, what does that planning and teaching look like?
So there are really two different parts of the business. There's what's called Medigap, which is for clients who are higher income. Those folks are tending to move towards what's called a Medigap Med Supplement plan. You actually don't need licensing for that. So many people, planners, are able to recommend. There's a carrier or two that people recommend all the time, and they direct their clients to that area. It doesn't help them with their prescription drug plans, but many planners will say, go onto Medicare.gov, find yourself a good prescription drug plan, and they feel like they've directed them a little bit. For those folks who have a little less income, one does need to be certified in all of the carrier offerings. There's also a national exam that has to be taken every single year. And actually, all the carrier exams have to be taken every single year when you are helping people understand what's called Med Advantage plans or Parts C and D. So if one stays in the higher income model where they're suggesting the higher premium Medigap plans, one can make some annuity revenue on those particular clients, yes. But for those who may not be able to afford them, you do need to be licensed and or utilize a resource that might be out there to help provide that service.
I love it, and that makes a lot of sense. And I think, providing more and more value to your existing client base, or even getting another hook into a prospect where you can offer something that might be, top of mind for them, especially going into open enrollment season, is so important. If you had just, one final note for, an advisor, an agent out there who's thinking about, what they should look at, maybe Medicare is an option they should add into their practice, what would your one recommendation be?
My suggestion, my comment would be is you really want to make sure you help your clients avoid the common mistakes and pitfalls. Healthcare and the budget around Medicare coverage, healthcare coverage is so vital as people get past the age of 65 and transition out of their group coverage. I believe it is part of the fiduciary responsibility of a allied professional, of a financial planner, of a CPA, to help them, guide them towards Medicare solutions. But it gives them peace of mind, and you want the client to look nowhere else but you for the answers.
I love that. And for more great tips on Medicare, we do have a wonderful blog that Mark has supplied, and we'll be running some webinar trainings as well. So, Mark, appreciate the partnership as always, and thank you for this valuable information.
Thank you, Brad.